Mr. Speaker, Lesiampe, I know him as a good performer, but Mr. Speaker, it is paramount and imperative that we Kenyans divorce our thinking from names and tribes. So long as we have standard operation procedures, Mr. Speaker, then it does not matter who's leading an organization because we know what is to be expected. Mr. Speaker, I'm persuaded to believe, and I want to persuade my colleagues to believe, that it does not depend on which ethnic background you come from for you to be able to deliver. This country, Mr. Speaker, for so long, we've held ourselves hostage to this tribal inclination, and therefore, I would want to say it is the time, now the high time, that we look at a country like it can be read by anybody, and the only thing that we need to do is to put up structures in place, to put operating manuals and procedures in place, so that no matter who takes leadership knows this is the minimum expected. To wind up, Mr. Speaker, I know the performance of this gentleman. I've seen the change. The challenges that this country is facing in the health sector need somebody who's bold enough to make decisions. And I'll say that this Lesiampe is doing the right thing. Let's encourage him. Let us contribute towards bettering our services instead of rewriting the book of lamentation, Mr. Speaker. Finally, Mr. Speaker, moving forward, even in the national arena, we must divorce ourselves from this tribal inclination that has continued to hold this country hostage for the last 62 years. Mr. Speaker, I submit.
Senator Ezena Remaletian.
Thank you, Mr. Speaker, and I rise to comment on the statement by Senator Okia Omtata, the able senator for Busia. Mr. Speaker, while we need to oversight all public institutions, hospitals included, we cannot, it is imperative to note that the challenges that are affecting Kenyatta National Hospital are affecting every other hospital across the country. And it is for that reason that we have seen reshuffle happening across our hospitals. I want to contradict the statement made by my deputy party leader, unfortunately, pointing fingers at Dr. Richard Lesiampe. Dr. Richard Lesiampe, Honorable Speaker, has been a person of integrity, has served this country in so many capacities, and is one statesman that I know is very capable in our country. We have seen the progress he has made with the Jaramogi Oginga Hospital. I have no doubt, Mr. Speaker, yes.
Just a minute, there is a point of order from Senator Lelegwe Steve.
Mr. Speaker, sir, on a point of order, when I go through the statement by Senator Mutata, the contents of that statement does not go well with what most senators have discussed on that statement. Mr. Speaker, sir, I've heard Senator Osotsi, Senator Omatinga, Senator Ledama, and Senator Esena discussing the qualifications of one Dr. Richard Lesiampe, which I think is not part of the statement.
And I think we should not bring this issue, and on a point of relevance, we should not be discussing someone unless you bring a substantive motion. And I request, Mr. Speaker, for any other senator who may wish to contribute on this statement to go on the matter being raised by Senator Mutata and not bring the name of one qualified Dr. Richard Lesiampe into a statement that does not concern this statement. Thank you, Mr. Speaker.
Thank you. Very well, proceed and finish.
Thank you, Mr. Speaker. And like I was saying, that we have seen very significant improvement in the Jaramogi Oginga Referral Hospital when there is an able head or an operational head, because we know, Mr. Speaker, that a fish rots from the head. When we have an able person taking the mantle of leadership in a crucial institution that is as far as a hospital, we have seen significant improvement. And it is for that reason that I am also personally very much against the naming of Dr. Richard Lesiampe in this matter. Mr. Speaker, as senators, we need to be to shun from tribal inclinations, especially when we are leaders and leaders who are
Coming to the close of this, you spoke so well. Give out 15 seconds to say goodbye.
Mr. Speaker, I am very proud as a minority in this country that I see some of our institutions like the KNH headed by a minority. I have no doubt he is going to work so hard to make sure that he has proven that indeed a son of the Samburu, a son of a small community, can equally deliver just like anybody else. Thank you, Mr. Speaker.
Next is Senator Chalage Samson.
Thank you, Mr. Speaker. First, Mr. Speaker, I want to respond to the statement by the Labour Committee. Mr. Speaker, I would have expected them to touch something on Micron, Mr. Speaker, because one Felix Limo that comes from Kosirai Ward in Nandi County, he died in Qatar, and it took a lot of interventions for his body to be repatriated. So I don't know what the Labour Committee, and I hope the minority leader still sits there to tell us what is happening with migrant workers, especially in the Middle East. Mr. Speaker, and secondly, because I have seen in their report, even on this issue of domestic workers, even locally, Mr. Speaker, I think a day or two, a Mamafua by the name called Saitun Kavaya, who lives in Kibra, was killed mysteriously in Kilimani. Yet no one has been arrested to that fact, Mr. Speaker. I appeal that the Ministry of Labor should look into issues of domestic workers. Maids and domestic workers are very important, especially if you are a bachelor in this Nairobi and you don't have a number of Mamafua, you are living badly in this city. And they form a very serious ecosystem because this Mamafua, Mr. Speaker, they'll come to your house, clean your clothes, prepare the food for the entire week. And therefore, when I saw how Mamafua Saitun Kavaya was killed, I hope the DCI should follow up, and no one should kill domestic workers. We need to be harsh on anybody who kills domestic workers, both locally and internationally, Mr. Speaker, especially in Qatar. Mr. Speaker, secondly and finally on councillors, Mr. Speaker, is we need to finalize. We invited the CS Mbadi. He didn't tell us when is he paying the councillors. The councillors serve this country, and there are more than 12,000. Some of them are still surviving, some of them are sick. Mr. Speaker, I want to appeal to the Labour Committee to come up with a legal framework to cure the issue of one payment to the councillors. Mr. Speaker, on that note, I want to thank you, because yesterday I saw you hosted former
Yes, that's the chair's honor.
Mr. Speaker, I want to celebrate you and thank you that you are providing leadership in Meru by bringing even nemesis, political nemesis like former Senator Linturi. And I'm happy he has abandoned Wamunyoro and is now joining the government courtesy of you, and we are proud of what you are doing as the Deputy Speaker. And we didn't make the wrong choice as the Deputy Speaker because you are one of our members, premier members of UDA, Mr. Speaker, and we will continue supporting you, Mr. Speaker, in Meru.
Senator Catherine Muma.
Thank you, Mr. Speaker. Mr. Speaker, I rise to contribute to Senator Mtata's statement regarding the state of Kenyatta National Hospital. Honorable Speaker, would you kindly ask Cherargei and team to listen in? I don't know why he always disrupts after we've listened to him. Can I?
No.
Yes, you are actually.
Chalage, you're almost now provoking the chair.
Thank you, Chair.
Because you are happy when members listen to you carefully. But when others are contributing, raising the issues, you now start making noise.
Thank you, Chair, and I hope my time has been said. Honorable Chair, the issue of Kenyatta National Hospital is a good statement, but I would want to request that 13 years into devolution, what the Senate should be doing is to help strengthen the intergovernmental relations around the health sector to help align the Nairobi County Health Function implementation and the national government implementation of referral services in Kenyatta National Hospital, so that we relieve Kenyatta National Hospital of the services that actually should be carried out by the county governments. Kenyatta National Hospital is burdened by carrying out all functions from level 1 to level 6. The Senate has done nothing around this. The Senate committees should also start scrutinizing the budget lines of parastatals like Kenyatta National Hospital in order for us to be able to find out whether they deploy any services, any funds towards the cleanliness, towards maintenance, towards repairs, because what we are seeing in social media in terms of the state of Kenyatta National Hospital suggests that we don't have the deployment of any monies towards maintenance, towards cleanliness, towards such like issues. So my suggestion is, instead of just a general scrutiny, we would want to find out how does Kenyatta National Hospital carry out its functions. Honorable Speaker, this is actually what we call the human rights approach to service delivery. The human rights approach to service delivery means...
Senator Kadri, 1 minute to conclude.
We can actually, but in order to deliver good services to patients, all aspects have to be looked into. And that is what this committee needs to do, rather than just focus on a personality somewhere or on the generalities of it, including sifting out the functional assignment so that the functions for counties are actually ceded to the county, and Kenyatta National Hospital is left to focus on the referral services so that it can deliver as best as it's able to with the equipment required to deliver the top-notch level 6 services. Thank you, Mr. Speaker.
Last but not least, Senator Nyamu Karen Jerry.
Thank you, Mr. Speaker.
I can't see you on my screen, Senator Duro. Proceed.
I want to contribute to
2 minutes.
the statement brought by Okiya Omtata on the Kenyatta National Hospital. Mr. Speaker, Kenyatta Hospital is the largest referral hospital in East Africa, and it cannot fail on the basics. Simple hygiene, working lifts, ventilation. I have been to Kenyatta Hospital myself, and I have seen patients waiting on benches and on the floor for hours. We have to give our patients dignity, Mr. Speaker. And 2 murders in a span of 6 months inside the wards raises serious questions on the security systems in that hospital, Mr. Speaker. We have to have accountability because we are pumping billions in that hospital every year. Where is accountability? We have to expand the wards to ease out congestion. We have to invest in the dignity of our people, Mr. Speaker. At the same time, despite the challenges, Kenyatta remains a symbol of hope for all Kenyans who cannot access private medical care. We have seen them performing miracles within the meager resources that they have. And historical, surgeries that give hope to the people who cannot afford the very expensive medical care. And in that, we have to not just complain, as my colleagues have said, we have to invest and make sure what we are pumping there is accountability. Thank you, Mr. Speaker.
Senator Duro, Fatuma.
Thank you, Mr. Speaker. I wish to join my colleagues in supporting this particular statement. Mr. Speaker, over the years, we have never gotten correct or right as far as healthcare services is concerned in this particular country. Mr. Speaker, the statement by Senator Umtata is very clear. It's talking about the challenges Kenyatta Hospital is facing. I know we all rush when we mention institution about individuals. Dr. Lesiembe is a personal friend to me, I've known him over 10 years, or even 20 years, if I'm not wrong. And he has nothing that could be called against him. Mr. Speaker, the budget that is allocated to Kenyatta National Hospital does not actually provide proper service delivery. If you look at the equipments actually provided at Kenyatta National Hospital, they are very old equipments that sometimes they break down. Mr. Speaker, Kenyatta National Hospital, I remember one time I used to work with Ministry of Health where they said they are going to decentralize KNH to all the provincial headquarters. And if that actually a proposal worked, we should not have had long queues at KNH, but we'll have serious cases, referrals at the National Hospital. Mr. Speaker, my time is running out. What we need at KNH is serious look into it and ensure that it's one of the best hospitals in this country that can provide services to our Kenyans.
Please give her some 30 seconds to finish.
Madam Speaker, we need to look into how we can give better service deliveries at KNH. The problem is there, but we cannot run away from it. Can we look into it and ensure that we have allocated enough budget to take care of services at KNH? And ensure that we have also decentralized some of the services that are provided at Kenyatta National Hospital. I thank you, Madam Speaker.
Next order.
Order number 8, motion, report of the Standing Committee on Finance and Budget on the county government's cash disbursement schedule for financial year 2025-2026. Resumption of debate interrupted on Wednesday, 24th September 2025, afternoon sitting.
Senator Mazayo.
Asante, Bispika. Bispika, cha kwanza ningependa kusema kwamba hospitali inayotegemewa sana katika nchi yetu ya Kenya ni hospitali ya Kenyatta National Hospital. Ni hospitali ambayo ina matumaini mengi sana kwa wakazi wa Kenya. Bispika, ni jambo la kusikitisha hivi sasa tukiona hospitali hiyo ikianza kuzorota. Juzi tulisikia kwamba mgonjwa ambaye alikuwa ameletwa ndani ya hospitali aliweza kupatikana amekufa na kuchinjwa kabisa kama kuku, ya kumaanisha kwamba hata security ama usalama wa wale wanaokwenda kule kama wagonjwa hakuna. Speaker, hilo ni mojawapo tu ya katika zile kesi ambazo zinahusikana na mambo ya Kenyatta National Hospital. Hiyo ni hospitali moja kubwa ambayo inatumikia hata nchi zingine za karibu, pengine kama Tanzania ama Ethiopia ama wapi, kote huko kunategemea hospitali hii. Speaker, ningependa kusema kwamba yes.
Would you kindly allow me to guide you? We have actually moved on to the next order, and we are on the schedule, and I was expecting that you are speaking on the schedule.
Madam Speaker, I accept that with tremendous respect.
Yeah.
But I had approached you and told you had pressed on Michael, but unfortunately this line is not working. And I requested that I be given some 2 minutes to contribute the same like all other colleagues have done. And that's why I took up the opportunity to come to you.
I think that
and you said it's
there was a
okay.
misunderstanding. Can you then finalize,
Okay.
then we can move on to the next order?
Then allow me to stop there then.
No, finalize whatever you were saying, then we will move to the next order again. We will call it afresh.
As a good lawyer, I was thinking of respecting instructions. So,
yes, I'm cognizant of the fact that it was a miscommunication.
Okay.
So,
I
just finalize and then we will
thank
call
you.
the next order.
Kwa hiyo, Speaker, kuna umuhimu wa kwamba ikifika saa ya uongozi katika hospitali hii tusiweze kuweka makabila yetu ndani. Tuangalie ni nani ambaye ana uwezo, ana taaluma ya kutosha ya kuweza kuongoza hospitali kama hii. Asante, Speaker.
Next order. No, I want it recalled because of the disorganization of the order, please.
Order number 8, motion, report of the Standing Committee on Finance and Budget on the county government's cash disbursement schedule for financial year 2025-2026. Resumption of debate interrupted on Wednesday, 24th September 2025, afternoon sitting.
Senator Mofire.
Thank you, Madam Speaker. Madam Speaker, yesterday I captured quite a number of my fellow senators' debate on this arrangement of disbursement of funds to counties. But Madam Speaker,
It is very sad that we have been around now close to 3 years, and we have witnessed some very serious disconnect between the exchequer and the counties. Madam Speaker, we are talking about now 3 months, where counties have gone without the intended allocations. People have gone without salaries. I don't know how one would explain a situation where all the way from June up to July, this is August, September,
we are going towards October. People have gone without salaries, especially the county staff. Madam Speaker, counties have borrowed. And you know, once you borrow from banks, once you pay with a lot of interest. I think as a House, Madam Speaker, we need to have a conversation around this arrangement. Because, Madam Speaker, that spirit of devolution is being diluted every other day. Because, Madam Speaker, we need to have an express dispensation on the timely disbursement of funds to counties. Actually, Madam Speaker, I think that is the reason why most of the governors would even want to claim that that is the genesis of quite a number of pending bills that we are witnessing. Because, you know, by virtue of having no funds in county doesn't stop the services. Yeah, we have those recurrent expenses that are being incurred almost every day. We have vehicles getting fueled. We have so many other miscellaneous activities that are taking place. And I'm very sure some of these activities are current under the arrangement of we are going to get money. So I think, Madam Speaker, we must get very clear arrangements on how we are supposed to make this disbursement effective. I don't know for what reasons. I think I quoted one of my good friends talk of a visit to Morocco, where we have efficient, very timely disbursement of funds to relevant counties, where you don't have even to engage the national government. I don't know what is the role of government in the whole exercise. No, we have those very independent institutions which are supposed now to make sure that counties get their money timely so they can run the services that are intended to be run. And we expect, maybe, Madam Speaker, once these funds are disbursed to counties, we expect the governors to be intelligent enough in making sure that money is put into proper use, so that the very essence of devolution is being realized. So, Madam Speaker, I strongly support that we pass this schedule so that maybe our counties can enjoy. But of course, Madam Speaker, it's very sad. For the last almost 3 months now, People are going without salaries, people are servicing their loans, some are servicing their school fees. And it's very pathetic, Madam Speaker, that we have to experience this kind of situation year out, year in. I support you, Madam Speaker.
Senator Oyomo.
Madam Speaker, from the word go, I want to declare that I support the report on the Standing Committee on Finance and Budget. Madam Speaker, counties are distinct governments. It is unfortunate that throughout the period of financial year, we are here always lamenting about disbursements. And Madam Speaker, to me, it is like the counties are on the receiving end when it comes to disbursement. And yet, the law is very clear, Madam Speaker, that there's a timeline that is stated by the 15th of each month. County governments, which are distinct governments, as enshrined in the law, the constitution of this country, must receive their funds. Madam Speaker, the reason that is always given is that these funds are not available. But something else that comes out very badly, Madam Speaker, is that at the end of the financial year, the county governments are given funds at a go. And yet, there's hardly time to spend these funds. Then somebody erroneously makes comments that county governments are supposed to be ready to use these funds. Madam Speaker, even the procurement plans that the counties have are drawn with the knowledge that funds will be disbursed at their rightful times. Madam Speaker, having said that county governments are distinct, it is important to note that we need timely disbursement, and not only timely, but as the report says, the disbursement of these funds must be stable and be predictable. Madam Speaker, predictability ensures that these funds are planned for. And some wise people said, and I believe them, and I know I'm one of them, that when you fail to plan, then you're planning to fail. Madam Speaker, the counties have various services that must be offered to our people at the counties. Key amongst them is the services of health. Just this afternoon, I've been here as these outstanding members of the Senate discuss the issue of Kenyatta National Hospital. And it is because health is key to all of us, Madam Speaker. For the counties to provide the services that are devolved to them, like health, which is a basic to our people, it means funds must be disbursed to them in time. We do not want a situation where when a schedule is already drawn out and approved, Madam Speaker, then we are treated to cases of counties lining up at the Comptroller of Budget's office or at Treasury. Madam Speaker, we have met the Comptroller of Budget several times as a Senate. I remember the last time the Comptroller of Budget was making a presentation while we were at Naivasha in a retreat. And the Comptroller of Budget continuously denied the fact that county officers always line up in her office in the process of approvals for disbursement. Madam Speaker, this is a truth, that there's a lot of paperwork that has to be done. And yet what baffles me, Madam Speaker, is that the Comptroller of Budget's office also has devolved officers at the counties.
So one wonders why, what kind of work this devolved officer of the controller of budget, referred to as the county office of the controller of budget, does with the county government throughout the month. Because all they should be looking at is to ensure that the documentation is done at the county, and officers do not need to spend all the time at the controller of budget's at the office of the controller of budget, going back and forth to the counties in the name of going back to get certain documentation. And this is a reality, Madam Speaker. Madam Speaker, what I'm saying is that the countries must have a seamless process of getting funds that are due to them, having been approved by the Parliament. Madam Speaker, there are several services that we are expecting the counties to offer in time, efficiently and effectively. I've mentioned health, Madam Speaker. We need to get, our people need to get drugs in hostels. Madam Speaker, it pains me when I'm in the village and you have women carrying sick children, or even women sick, and even men, Madam Speaker. When they are sick and they go to hostels, and then they miss drugs in the names that funds have not been disbursed to counties. Madam Speaker, it is important to note that sickness comes at any time. Our people cannot only wait to be sick when their funds have been disbursed. And so that is an aspect of planning that must be done well. Madam Speaker, we want to see our people having water as provided by the county government, as enshrined in the law. We want to have our people getting various services, access roads being done as given in the devolved functions. And Madam Speaker, even in agriculture, I'm a farmer, Madam Speaker, although a small time, but I'm looking forward to getting to big time. And I see the way farming is also expensive. We want our farmers getting services. We want our farmers getting the right seeds. We want our farmers getting the right extension services, advice from the county government, because agriculture is devolved, Madam Speaker. So, Madam Speaker, I support this report, and we look forward to a time when the issue of funds not in counties will be a thing of the past. Madam Speaker, you often hear from our counties in the national news about workers that have not been paid for months. We also want to ask our counties, our county governments, that they must do good planning, that they know already the number of employees they have, they know the required amounts that they will be paid in the course of the years. And so this story of workers, people going without pay, is not a good story, Madam Speaker, because these are people who have worked for their governments. These are people who have families, Madam Speaker. These are people who have a number of responsibilities that their families look up to them to perform. So, Madam Speaker, I support this, and I want to say that Treasury must adhere to the constitutional requirements as enshrined in the Constitution as per disbursement of monies to county, and the Treasury must also ensure that they do not keep monies up to the last minute when the financial year is ending, because we do want money spent well, and we do not want to have any reasons for the county governments to get into any improper ways of spending public funds. Madam Speaker, I support.
Senator Mariam.
Thank you, Madam Speaker, for giving me this opportunity. Madam Speaker, I also raise my foot so that to add my voice to this motion of cash disbursement schedule, which was passed by the Finance Committee. I was one of the members who passed the schedule, Madam Speaker. Madam Speaker, my concern is let Treasury not take this disbursement as formal. This is a formality we normally do yearly. Let them not take that. It must be a binding document that make the Treasury to be on toes so that they can remit by 15 of every month, the way the schedule read, Madam Speaker. Madam Speaker, in the schedule, I realize the highest counties paid is one of them is Mandera County. Madam Speaker, if I take you through the schedule, July, the Mandera County received 993 M, that is million. August, 971 million. September, 1 billion. October, 1 billion. November, 1 billion. December, 981 million. January, 1 billion. February, 1 billion. March, 981 rather. April is 1.1 billion. May, 1 billion. June, 981 million. Madam Speaker, this shows that we are almost the highest figure. The total amount is 12.3 billion, Madam Speaker. Madam Speaker, I'm reading this because, Madam Speaker, in our area, nowadays there is a lack of water. There is also an issue of healthcare system. Madam Speaker, I urge the counties to take priorities where it concerns the people, Madam Speaker. Madam Speaker, in this figure, if they have planned well, we urge that the county, Mandera specifically, that the issue of water will be answered and will be taken care of, Madam Speaker. Madam Speaker, a while ago, we are commenting about the healthcare, about overcrowding of the KNH, Madam Speaker. Most of the referral is from the county, which they themselves can handle. Madam Speaker, that shows that the counties nearby, they are not taking their proper role on the health sector. So I urge most of the counties to prioritize of the health center and the health facilities and the service delivery to the county. Madam Speaker, on this schedule, by 15th of every month, the Treasury must disburse money to the county. Because the county, specifically this recurrent expenditure, especially the salary, the staff of the counties, they need to be motivated. One thing to motivate them is by giving their dues on time. Because they have to pay their rents, they have to pay their foodstuffs, school fees, Madam Speaker. If the county delay their dues, Madam Speaker, where will they get their expenditure incurred, Madam Speaker? Madam Speaker, on this, when the county receive the money, let them not to use haphazardly. It's better they have to use priority, they have to put recurrent figure back, not to be used in any other issues. They have to pay their rent, their salaries, recurrent expenditure, so that their staffs can be motivated, Madam Speaker. Madam Speaker, I wanted to talk to the Treasury, Madam Speaker. They are not supposed to hold the figure. They're saying the delay might be because of the collection of the revenue, Madam Speaker, by the KRA. Madam Speaker,
if we put ourselves in that shoes, it might happen that the county cannot receive their money on dues on 15th. Mr. Speaker, we have to restrict that the latest by 15, the county must receive their due. So whatever the Treasury plan themselves, we don't want to know. The county must continue and get 15th of every month, Madam Speaker. Madam Speaker, there is a bill I created. I passed and the House dropped it because that bill is about impromptu payments. If at all, the county also engage in the contractors are supposed to pay on time. So in that scenario, the Treasury also must aware that they are supposed to pay the counties on time. In that bill, there is a legal mandate that penalties if you are not paid the figure, which will be accumulating. Madam Speaker, unfortunately, it has not gone through. If we will have passed and restrict the Treasury that if it passes 15th of every month, there is a percentage of penalties. They will have, KRA will do all their best. By 15th of every month, they have the revenue, Madam Speaker. Madam Speaker, if I take to e-procurement, Madam Speaker, in my thinking and also my understanding, the e-procurements can solve the issue of this elephant called pending bills, Madam Speaker. Because everything's before done, the procurements are normally before done under the carpets. Madam Speaker, now, if the county engage themselves in e-procurements and everyone can see which contract has been given to so, there must be also, when it comes to payments, it is done on time. And this issue of pending bills will be done. And also the voiding of payments. Madam Speaker, sometimes the county, what happens is a county requests figure through controller of budgets, and when they wire the money to the counties, county pay different person, Madam Speaker. But when it comes to this system, the system shows that, as an example, Senator Muma, you have that figure, and it has been requested from the controller of budgets. When it comes to the county for your payments, they cannot pay another person. They have to pay you. Because it is in the system, it cannot be pay another person.